There are millions of women over 40 who go to bed every night thinking the same thing. That this exhaustion, the kind that doesn't go away after sleep, is just part of getting older. That the dryness in their eyes, the ache in their joints, the brain that just won't cooperate anymore. They tell themselves, this is just aging. Maybe their doctor confirmed it. Maybe they read it online. Maybe they just assumed. But here's what most of them don't know. Some of those symptoms, the ones they've been quietly living with for years, are not aging at all. They are the early warning signs of an autoimmune condition that affects an estimated 4 million Americans, the majority of them women, and takes an average of nearly a decade to diagnose. It's called Sjögren syndrome. And in this video, I'm going to show you 10 signs that most doctors overlook, and most women explain away, that may be pointing to something far more specific than age. If that sentence just landed for you, if something in what I've described so far sounds familiar, I've put together a symptom map that shows exactly how this condition progresses, what shows up at each stage, and where the standard tests are most likely to miss it. Type symptom map in the comments right now and I'll send it to you directly. Because what I'm about to show you next is why that map matters more than most people realize, and why the stage you're in changes everything about what happens next. Think about the last few months. Maybe you've been more tired than usual, not just sleepy, but bone-level tired. The kind where a full night of sleep still leaves you reaching for coffee by 9 a.m. You've probably thought, I'm just pushing too hard. I'm getting older. This is normal. Or maybe you've noticed your eyes feel gritty and irritated. You've been blinking more. You keep drops in your bag now. You chalked it up to screen time. Or your mouth has felt drier than it used to. You've been drinking more water, but the dryness doesn't quite go away. You figured it was stress, or a medication, or just something. And then there are the moments where your brain just slips. You walk into a room and forget why. You're mid-sentence and the word you need just disappears. I guess this is just what 40 feels like. That's what most women say. That's what most doctors hear. And that's exactly why Sjögren's gets missed, for years, sometimes decades, while the damage quietly accumulates. Here's the truth about Sjögren's. It is not a rare disease. It is one of the most common autoimmune conditions in the world. It primarily targets women. It most often develops, or becomes noticeable, in the 40s and 50s. And its earliest symptoms, fatigue, dryness, brain fog, joint pain, are almost identical to what most doctors will simply call perimenopause or normal aging. That overlap is not a coincidence. It is the reason Sjögren's is one of the most underdiagnosed conditions in women's health. So let's go through the 10 signs. Some of these you may have written off 100 times. By the end of this, I want you to see them differently, as a pattern, not just a coincidence. Sign number 1. Persistent dry eyes that drops don't fully fix. Picture this, you're at your desk, mid-afternoon, and your eyes feel like they're filled with sand. You reach for your eye drops, again. 10 minutes later, the gritty feeling is back. Most women assume it's screen time. Their doctor might say dry eye syndrome and hand them a prescription lubricant. And while that might help temporarily, it doesn't address what's actually happening. In Sjögren's, the immune system attacks the moisture-producing glands, including the lacrimal glands in the eyes. The result isn't just occasional dryness. It's a persistent, progressive reduction in tear production that artificial drops can only partially compensate for. The distinction matters. If your dry eyes are chronic, if they are worse in the morning, if they are accompanied by light sensitivity or blurry vision that clears when you blink, that pattern deserves a closer look. And dry eyes are just the first layer. What's happening underneath goes much deeper. Sign number 2. Dry mouth that water doesn't quench. You drink water constantly. You keep a bottle on your nightstand. But no matter how much you drink, your mouth feels dry, especially at night and first thing in the morning. You might notice you're waking up more often just to sip water. Eating dry foods has become uncomfortable. You've started chewing gum more. Doctors often associate this with medications or anxiety. But in Sjögren's, the salivary glands come under direct immune attack. Saliva production drops significantly, which isn't just uncomfortable. Saliva protects tooth enamel, aids digestion, and prevents oral infections. Without it, dental decay can accelerate, and many women with Sjögren's report a dramatic change in their dental health before ever getting a diagnosis. If you've had unexplained cavities, recurring mouth sores, or a persistent sensation of dryness that feels different from thirst, file that away. Sign number 3. Fatigue that sleep doesn't fix. This is the symptom women describe most often, and dismiss most quickly. It's not tiredness. It's something heavier. You sleep 8 hours and wake up feeling like you didn't sleep at all. You hit a wall at 2 p.m. that feels almost physical. You cancel plans not because you don't want to go, but because you genuinely don't have the energy to get ready. The assumption is, I'm overextended. I'm perimenopausal. I'm just getting older. But in Sjögren's, this fatigue is driven by systemic inflammation. The immune system is in a constant state of low-grade activation, consuming energy that should be available for your daily life. This is not tiredness that a vacation fixes. It is fatigue that tracks with inflammatory activity in the body. The key marker is this: it doesn't improve proportionally with rest. The more out of proportion the exhaustion feels relative to what you're doing, the more relevant that becomes. Sign number 4. Brain fog, memory slips and word loss. You're mid-conversation and the word you need just vanishes. You walk into the kitchen and stand there, unable to remember why you came. You read the same paragraph 3 times and it doesn't stick. Most women over 40 assume this is menopause. Many doctors confirm that assumption. But cognitive symptoms in Sjögren's are not just hormonal. They are neurological. Sjögren's is known to affect the central and peripheral nervous system in a subset of patients, and cognitive dysfunction, often called Sjögren's fog, is one of the more frequently reported but least discussed symptoms. Inflammatory cytokines can cross the blood-brain barrier and disrupt neural function. Some researchers believe the nervous system involvement in Sjögren's may begin earlier than the classic physical symptoms. This is the neurological layer that most primary care visits simply don't reach. The brain fog alone would be enough to dismiss. But what if it's paired with something in your hands? Sign number 5. Tingling, numbness, or burning in the hands and feet. A pins and needles feeling in your feet when you wake up. An occasional burning sensation along your forearms. Fingers that feel oddly numb after you've been sitting still. You might assume it's poor circulation, a pinched nerve, or you slept in a bad position. But peripheral neuropathy, nerve damage in the hands and feet, is a recognized neurological complication of Sjögren's. In some cases, it appears before the classic dry eyes and dry mouth that doctors use to identify the condition. The immune system attacks nerve tissue directly, disrupting the signals that travel through the peripheral nervous system. For some women, this tingling is the first real sign that something systemic is happening, years before anyone connects it to Sjögren's. Sign number 6. Joint pain and morning stiffness without swelling. You wake up and your fingers feel stiff. Your knees ache going downstairs. Your wrists feel tight for the first hour of your morning. You probably assumed it was arthritis starting, or that this is just what joints feel like in your 40s. Joint pain in Sjögren's presents differently from rheumatoid arthritis. There's usually no significant joint swelling or deformity. Instead, it's a migratory aching, pain that moves between joints, worse in the morning, easing as you move. It can be dismissed repeatedly as early arthritis or muscle soreness. And because it often travels, wrist this week, shoulders next week, ankles after that, it can feel inconsistent enough that it doesn't seem like a real condition. That inconsistency is actually a pattern. Sign number 7. Skin dryness and unusual sensitivity. Your skin has become drier than it used to be. No amount of moisturizer seems to fix it. Some women notice their skin feels oddly sensitive. Certain fabrics feel irritating, sun exposure feels more intense. The skin has its own moisture-producing functions, and when the immune system is attacking glandular tissue broadly, skin dryness is a common extension. But more specifically, some women with Sjögren's develop cutaneous sensitivity or small fiber neuropathy that shows up as unusual skin sensations, itching with no visible rash, burning on the surface of the skin, or a heightened reaction to temperature changes. When skin symptoms accompany the other signs on this list, they round out a picture that goes beyond routine dermatology. Sign number 8. Disrupted sleep, not just insomnia. You fall asleep fine, but you wake at 2 or 3 a.m. and can't get back to sleep. Or you sleep through the night but wake exhausted, as though sleep did nothing for you. Sleep disruption in autoimmune conditions is not fully understood, but it's well documented. Inflammation affects sleep architecture, the stages of sleep the body cycles through. In Sjögren's, nighttime dryness in the mouth, throat, and nasal passages can cause frequent waking. Pain and nerve discomfort can prevent restorative deep sleep. And the fatigue itself creates a cycle where the body is simultaneously exhausted and unable to recover through rest. If your sleep feels broken in quality rather than quantity, if you're sleeping enough hours but waking tired, that distinction matters. 8 signs in. And every single one of them has a reasonable, dismissible explanation, until you see them together. Sign number 9. Recurring respiratory symptoms, dryness in the airways. A dry cough that shows up without any cold or allergy trigger. A feeling of dryness at the back of the throat that doesn't respond to water. Hoarseness in the morning. A persistent sensation of needing to clear your throat. Most women who experience this have been told it's allergies, acid reflux, or postnasal drip. Many are prescribed antihistamines or antacids. But the moisture glands in the airways, including in the trachea and bronchi, can also be affected in Sjögren's. This is called Sicca syndrome, and it extends beyond the eyes and mouth to include the respiratory tract. In more advanced cases, interstitial lung disease is a recognized complication. But in early stages, it often presents as nothing more than a dry throat and a cough that won't quite go away. Sign number 10. Swollen parotid glands, the sign most doctors miss. This one is less commonly known, even among women who are already familiar with Sjögren's. The parotid glands are the large salivary glands located just in front of and below the ears. In Sjögren's, they can become intermittently swollen, creating a fullness or puffiness in the face near the jaw that comes and goes. Many women describe it as feeling like their face is slightly bloated on one side, or noticing a firmness near the jaw that wasn't there before. It's often attributed to a dental issue, a lymph node, or simply the way my face looks now. But recurring parotid swelling is considered one of the hallmark clinical signs of Sjögren's, and when it appears alongside dry eyes, dry mouth, and fatigue, it significantly strengthens the diagnostic picture. The problem is that many primary care physicians are not trained to routinely check for parotid involvement. And without that check, the sign gets missed entirely. I want to come back to something important. Several of the signs I just described, the brain fog, the tingling in the hands and feet, the skin sensitivity, the disrupted sleep, these are not just side effects of dryness or inflammation. They are signs that Sjögren's may be affecting the nervous system directly. Neurological involvement in Sjögren's is a serious and underrecognized dimension of this condition. Research suggests that somewhere between 20 and 60% of people with Sjögren's experience some form of neurological symptom, ranging from mild cognitive changes to more significant peripheral neuropathy. And in some cases, the nervous system symptoms come first, before the classic Sicca symptoms that most doctors are trained to look for. This is one of the primary reasons Sjögren's gets misdiagnosed. A neurologist sees peripheral neuropathy and looks for other explanations. A rheumatologist looks for the classic dry eye and dry mouth presentation, and doesn't ask about tingling. A GP attributes brain fog to age or stress. No single specialist is always seeing the full picture. And without that full picture, the diagnosis doesn't happen. So why does this keep happening? The diagnostic criteria for Sjögren's focuses primarily on glandular involvement, specific tests for tear and saliva production, a lip biopsy to look for immune cell infiltration, and a blood test for specific autoantibodies called anti-SSA and anti-SSB. But here's the complication. Up to 25 to 30% of people with Sjögren's test negative for these antibodies. They have the condition. The symptoms are real. But the blood test comes back normal. And that negative result becomes the end of the conversation. Add to that the fact that the symptoms overlap so heavily with perimenopause, fibromyalgia, depression, and chronic fatigue syndrome, all of which are already underdiagnosed in women, and you have a condition that can disappear into a cloud of other explanations for years. The average time from first symptom to confirmed Sjögren's diagnosis is between 6 and 10 years. 6 to 10 years. Living with symptoms. Being told everything is fine. Adjusting and adapting and quietly wondering. If you've been told your symptoms are just aging, but it doesn't feel like just aging, that instinct matters. Your body is trying to tell you something. The women who finally get a diagnosis often say the same thing. I knew something was wrong. I just couldn't prove it. You don't need to prove it alone. But you do need to understand what you're looking for. Look at what we've covered. Persistent eye and mouth dryness. Fatigue that rest doesn't restore. Cognitive symptoms. Nerve tingling. Joint stiffness. skin and respiratory dryness, sleep disruption, parotid swelling. Individually, each of these has a dozen explanations. Collectively, they form a pattern that points in one direction. Sjögren's is a systemic condition. It doesn't stay in one place. It doesn't present as one clean symptom. It moves across the body, affecting moisture, nerves, joints, cognition, in ways that don't obviously connect unless you know what to look for. And that's exactly the problem. Most women don't know what to look for, because no one has ever mapped it out for them. What most women with Sjögren's don't realize is that this condition doesn't just exist, it progresses. There are recognizable stages. Early presentation, secondary involvement, systemic complications. And the stage you're in changes what you should be monitoring, which specialists are most relevant, and what tests are worth requesting. Most women don't discover which stage they're in until they're already further along than they needed to be. Which is exactly why I put together what I call a symptom map. The symptom map shows you how these signs connect to each other and how they tend to progress over time, from the earliest signs most women dismiss, through the patterns that indicate deeper involvement. Type symptom map in the comments and I'll send it to you so you can see where you might be in this pattern. If you've spent months, or years, explaining away symptoms and being told everything is fine while something still doesn't feel right, type not normal in the comments. Because your instinct that this isn't just aging deserves to be taken seriously. And if you've been given a different explanation for these symptoms, chronic fatigue, fibromyalgia, anxiety, perimenopause, and it still doesn't quite fit, type misdiagnosed in the comments. Because there's a pattern here that may finally give you the clarity you've been looking for. There's more to understand about how Sjögren's progresses and what the early management window looks like. I'll be covering that in a follow-up. If you want to know when that goes up, make sure you're subscribed. And if you're watching this and someone you know has been struggling with unexplained symptoms for years, share this with them. Because the diagnosis gap in Sjögren's is not just a medical problem. It's a knowledge problem. And this is how that changes.